Primary biliary cirrhosis versus primary sclerosing cholangitis. Always an important question for your exams. But remember first, the PBC has now been renamed as primary biliary cholangitis because a lot of them actually don't have cirrhosis when they present to us. So how do we separate the biliary cirrhosis cholangitis versus sclerosing cholangitis? Well, first is age. Typically, you will see PBC in a middle-aged female versus sclerosing cholangitis would be typically an elderly male, and there is a strong association that helps you, that is inflammatory bowel disease. Primary sclerosing cholangitis has a strong association with inflammatory bowel disease. Also, it is the antibodies which can help you to differentiate. There is a anti-mitochondrial antibody which is typically associated with primary biliary cirrhosis, and there is a p-ANCA which could be associated, not as strongly but could be present in primary sclerosing cholangitis. When you look at the pathophysiology, in PBC, the pathology is completely intrahepatic, while in PSC, the pathology is both intra as well as extrahepatic. That helps you differentiate when you do imaging. The imaging of choice is MRCP. If you do an MRCP, PSC typically will have a beaded appearance or a prune tree appearance. Such an appearance is not something expected in PBC. The differentiation also helps because there is a strong association of malignancy with PSC, cholangiocarcinoma. If you overall look at the prognosis, PBC responds well to ursodeoxycholic acid, whereas the treatment for PSC is still under trials and we don't have very good results over there. So I hope you remember the two differences, and I hope you remember that the name has changed.